Welcome back to our channel, where we share the latest news and untold stories about Catherine, Princess of Wales, and her royal family. Today, we bring you some news. The Oncologist has revealed updates regarding Catherine's ongoing battle with cancer, marking her return. Princess Catherine, the Princess of Wales, has shown remarkable elegance and strength in response to her recent cancer diagnosis. In a surprising turn of events, Princess Catherine shocked the world by disclosing that she was receiving prophylactic chemotherapy after having abdominal surgery to remove a malignancy. Her journey has shown her resilience and resolve, and her recent presence at the Trooping Colours ceremony has sparked renewed public curiosity and worry about her state of health. Adjuvant chemotherapy, also known as preventative chemotherapy, is a therapeutic approach that aims to reduce the risk of cancer recurrence. The process entails using anti-cancer medications to eradicate any remaining cancer cells that may have metastasized from the original tumor location. After the first treatment, usually surgery, we often use adjuvant chemotherapy to effectively eliminate any residual microscopic cancer cells. During a most recent episode of the Royal Record radio show, an expert in cancer shared significant and informative details about Princess Catherine's medical care. Experts engaged in a conversation about the complexities of preventive chemotherapy and the future obstacles facing Princess Catherine. There is a period of ambiguity, the expert said. It is evident that she experienced a surgical procedure for cancer. She instructed us not to make assumptions about the specific type of cancer, but it was located in the abdominal region. The team performed a surgical procedure on her abdomen. She is undergoing prophylactic chemotherapy, typically administered for a duration of 6 months. We use adjuvant chemotherapy, also referred to as preventative chemotherapy, to reduce the risk of illness recurrence. Therefore, the scans do not reveal any evidence of cells that may have metastasized. However, if we see a potential for the illness to recur, we provide chemotherapy called adjuvant chemotherapy. The specialist's answer elucidates the underlying reasoning for Princess Catherine's therapy. Adjuvant chemotherapy serves as a proactive measure to avert cancer's recurrence. It is a commonly used method in cancer treatment, particularly for tumors that have a significant likelihood of returning. Adjuvant chemotherapy improves patient outcomes by specifically targeting any remaining cancer cells, hence increasing the likelihood of long-term survival. Princess Catherine has faced several difficulties throughout her chemotherapy treatment. She acknowledged her therapy's fluctuations openly. "I have implemented significant strides, but as anyone undergoing chemotherapy will understand, there are days of improvement and days of difficulty," she stated. During days when you are not feeling well, you experience physical weakness and fatigue, necessitating rest for your body. However, on the days when you experience improved physical strength and well-being, you desire to fully capitalize on this positive state. Her statements strike a chord with many who have experienced chemotherapy, since the treatment may prove psychologically as well as physically demanding. Chemotherapy works by selectively targeting rapidly proliferating cells, including both malignant cells and healthy cells inside the body. These adverse effects might include tiredness, nausea, alopecia, and an elevated susceptibility to infection. An in-depth exploration of chemotherapy. Chemotherapy, also known as chemo, is a fundamental aspect of cancer therapy. It utilizes potent medications to eradicate cancer cells and inhibit their proliferation and division. You can administer chemotherapy as a standalone treatment or in combination with other therapies such as surgery and radiation therapy. The goal of chemotherapy is contingent upon the specific classification and progression of cancer, as well as the patient's general well-being. There are actually several variations of chemotherapy, each serving a distinct purpose. Princess Catherine is undergoing adjuvant treatment, which includes chemotherapy. We use it after the first therapy, often surgery, to eradicate any leftover cancerous cells and minimize the likelihood of the cancer returning. Curative therapy. In some instances, chemotherapy as a standalone treatment may provide a complete cure for cancer. The objective of this treatment is to totally eliminate the cancer, thereby avoiding its recurrence. Neoadjuvant therapy is the administration of chemotherapy prior to radiation or surgical therapy to reduce the size of a tumor, thereby facilitating its removal or treatment. When cancer is no longer curable, we use palliative treatment, also known as supportive care. In such cases, chemotherapy is administered to reduce the size of tumors and ease symptoms, therefore enhancing the patient's overall quality of life. The efficacy of chemotherapy is contingent upon many circumstances, including the specific kind and site of the disease, its stage, and the patient's general well-being. Oncologists, medical specialists with expertise in cancer treatment, meticulously customize chemotherapy regimens to suit the specific requirements of each patient. The chemotherapy encounter. The method of administration of chemo is dependent on the specific medications implemented and the patient's therapy regimen. One can administer chemotherapy either in a systematic manner, circulating throughout the entire body, or in a localized manner, focusing on a specific location. Many methods are available to administer systemic chemotherapy, a widely used treatment. Intravenously, we administer chemotherapy medications by directly injecting them into a vein, typically in the arm. This approach facilitates the systemic distribution of medicines. Administration, injecting chemotherapy medications, allows for direct delivery of the treatment into the bloodstream. Orally, certain chemotherapy medications are available in the form of pills or liquids, making them easier to administer in a home setting. Topically, to specifically target and treat certain forms of skin cancer, physicians may administer some chemotherapy medications as a cream. In some cases, chemotherapy may target a specific area of the human body. Intra-arterial chemotherapy. This technique involves administering chemotherapy directly into the arteries that supply blood to a tumor. Intracavitary chemotherapy refers to the administration of chemotherapy directly into a bodily cavity, which might be the urinary tract or abdomen. Hyperthermic peritoneal chemo is a therapeutic technique that involves administering hot chemotherapy directly into the abdominal cavity after a surgical procedure. Intrathecal chemotherapy involves administering chemotherapy drugs directly into the space between the cerebral cortex and spinal cord. The duration of therapy with chemotherapy varies based on the specific cancer type, the medications used, and the individual's reaction to the treatment. A single treatment of chemotherapy may range from a few minutes to several hours, and the majority of patients need to undergo numerous sessions over the course of several months or weeks. Treatment regimens often consist of alternating cycles of chemotherapy and intervals of rest to facilitate the body's recuperation. The efficacy of chemotherapy is determined by a variety of factors, including the disease's specific type and site, its stage, and the patient's general health. Oncologists, specialized medical practitioners in the field of cancer treatment, meticulously customize chemotherapy protocols to suit the particular requirements of each patient. Chemotherapy's adverse effects. Chemotherapy medications selectively target rapidly dividing cells, including both cancerous and non-cancerous cells. This could result in a variety of adverse effects, a few of which may be temporary, while others can last long after therapy is completed. Chemotherapy's typical negative outcomes include fatigue. A common side effect can be incapacitating and have an impact on daily functioning. Chemotherapy medicines may cause irritation of the stomach lining, resulting in symptoms such as feeling sick and throwing up. Antiemetic drugs may effectively control these symptoms. Hair loss, also known as alopecia, is a common side effect of chemotherapy treatment. This may be emotionally challenging for a significant number of patients. Hair regrowth often occurs after therapy is completed. Infection. Chemotherapy may compromise the body's immune system, increasing susceptibility to infections. Patients should implement measures to prevent contact with pathogens. Anemia. Chemotherapy may decrease the quantity of red blood cells, resulting in anemia and symptoms that include exhaustion and difficulty breathing. Hemorrhaging and contusions. Chemotherapy might impair the body's capacity to generate platelets, which are essential for coagulation. This may increase the likelihood of hemorrhaging and contusions. Oral ulcers. Chemotherapy may induce ulcers in the oral cavity and pharynx, resulting in discomfort when consuming food and beverages. Chemotherapy may impact the digestive tract, causing either constipation or diarrhea. Anorexia. Alterations in gustatory perception and feelings of nausea may lead to a decrease in appetite, posing challenges to maintaining adequate nutritional intake. Effectively managing these adverse reactions is an essential component of cancer therapy. Oncologists and healthcare professionals collaborate closely with cancer survivors to devise ways for mitigating symptoms and enhancing quality of life during the course of chemotherapy. Communication from the Ohio Clinic. Chemotherapy is a widely used and very successful treatment for cancer. You can use it alone or in conjunction with other therapies to specifically and effectively eliminate cancerous cells. We customize the chemotherapy regimen and treatment protocol to each patient's individual circumstances, taking into account the specific kind and stage of cancer, as well as the patient's general well-being. Although chemotherapy may induce adverse effects, healthcare practitioners may effectively control most of them. Chemotherapy is an essential weapon in the battle against cancer due to its ability to eliminate cancer cells and enhance the overall well-being of patients. Princess Catherine's experience with prophylactic chemotherapy underscores the difficulties and determination needed to handle cancer treatments. Her bravery and resolve are a source of motivation for several others, and her willingness to share her personal journey contributes to the promotion of knowledge and comprehension of the intricacies of cancer therapy. The global community is closely observing Princess Catherine's ongoing treatment, offering their respect and support, eagerly anticipating her complete recuperation and resumption of her official responsibilities. Her narrative serves as a poignant testament to the resilience of the human psyche and the significance of medical progress in the battle against cancer. Thank you for seeing the video. Kindly share your opinions and farewell for now.